people's health is so dramatically influenced by the circumstances in which they're living that have nothing to do with the medical system. My name is Minna Silberberg, and I am an associate professor in the Department of Family Medicine and Community Health at Duke University. The purpose behind our volume is to provide case studies of how you would do interdisciplinary, community-engaged research, looking at the intersections of health and housing issues with a particular bias towards implications for policy. So we have 6 case studies. The first one that comes to mind is the chapter that was done by the team in Baton Rouge. They go into a very extensive discussion of the history of Baton Rouge and the way that racial inequity and systems meant to divide the city and to allocate resources differently based on race have affected the very concrete ways that they have affected the lives of people in Baton Rouge. I was really impressed by all the different benefits that I saw from all the different chapters. They're quite different in terms of the way that people went about their work, the kinds of things that they were working on. And they're also refreshingly honest about some of the challenges they faced. And yet, in all cases, they really demonstrate both the insights that you get and also the unexpected but positive directions that your work can take. I was a co-author on one of the case studies in the book, and in our case, we were looking specifically at services meant to support people who were homeless or living in institutions to obtain and maintain housing. There's always something new that, some new perspective that it gives me on the practice of community engagement. In the concluding chapter, we lay out some questions that we think are really ripe for further investigation and discussion. We're really hoping that other people, as well as ourselves, will take up those questions and explore them. And we look forward to seeing what might come out of discussion in those areas.